So welcome again to an episode of the Train the Trainer podcast, trying to bridge the gap between science and practice and vice versa. And today I have a guest, Nicole, and I have to pronounce it correctly now. Florisi, is it?
Yes.
It sounds Italian.
It is. It's the one gift from my ex-husband, besides my son. I got a cool last name and an amazing kid.
Okay, that's great. Yeah. What would be the best way to introduce you? What would you like the most?
Oh, I don't know. I don't know if there's any one thing. Obviously, you know where I work for Science, but I think if I had to basically summarize it, I'm just out here trying to help officers, law enforcement, first responders, be healthier and lead healthy lives. And that's really my passion, aside from everything else I do, is after we serve our communities. And this is a little crass, but we would take a bullet for somebody else and take a bullet sometimes for somebody who would piss on us if we're on fire. And we deserve to thrive and be healthy and not some of the negative outcomes we're seeing. So that's really where I put a lot of my focus in general, if that makes sense.
Yeah, makes sense. So officer health, officer longevity, mental health, resilience, is that what you're saying?
Yes, along with physical health. I don't think we can split the two. Physiology and our brain flexibility and brain health are all tied together. Sometimes I think we focus a little bit too much on the split, and I'd rather focus on bringing it together. And I think we see the split where we're getting better. Don't get me wrong. I think we're making great strides talking about. I'm a little over the term officer wellness. I think we need to get past wellness and talk about brain flexibility, just like we do body flexibility, right? And we talk about body health, and we need to talk about brain health, but we need to marry them up. They're not separate. A healthy body, healthy mind go together. So I think we need to start a little bit more of an integration in that conversation. But we really need to rope in that brain health piece instead of kind of leaving it off to the side.
What do you mean by brain health? What?
So you work in like the athletic field to a degree, like you're an applied scientist, you teach that kind of stuff. So we're always talking about what do we want from our body, right? How do we have our body healthy? We talk about some basics, right? Hydration, clean eating, exercise. What do we want from our muscles? We want them to be strong. So we do weight bearing exercises, right? We want to focus on strength. We want power, but then we talk about, hey, we want flexibility in our body. We want our joints to be limber. We want to be fluid. We don't want to have tight resistance in our body. And we put a lot of focus on that. The brain is really no different. We want our brain to be flexible. We want it to be adaptable to change. We want it to adapt to all the things that we see as first responders. And I would submit to you that's law enforcement, right? Paramedics, fire, EMS, that realm. But I would take a step further to include our military, people who are serving in a field where they see a lot of negativity, right? It's just part of the job. So how do we make our brain flexible? How do we make our brain strong? How do we build resilience? And I don't know what you see in your line of work, but resilience is almost turning into a bad word. Everybody's over that word. And I think that's extremely important. Resilience and flexibility are extremely important. So we don't spend a lot of time training the brain. It doesn't mean that we're not trying to learn things or we're not trying to read in areas that interest us. But a colleague of mine, she brings up a point called a psychological Kevlar. What is your psychological Kevlar for when you go to work? And that can also be for therapists, psychologists, people who bridge the gap. And that was kind of big to me because I never really thought about it in that term. I've been a police officer for 22 years. I still am part-time. I'm not ready to give it up yet. But every day we go to work, and we have our uniform, we have our vest, we have our belt, we have our tools. And when somebody's like, what is your psychological Kevlar? How do you deal with everything else? And I thought that's a really good question. And I'll give you an example. When I was doing my internship to be a therapist, my clinical supervisor was fantastic, right? But she asked me that same question. How do you not take home what you hear when you're being a therapist? What does that look like? And I was a little cocky at that time. I was like, what is going to bother me as a therapist that I haven't already seen as a police officer? Like I've seen it in person. I'm doing these type of investigations. So But it got me thinking, that's a good question. And so what she would do every day when she came to work, she also does yoga. She's a first responder yoga teacher as well, aside from that. She said, Nicole, I picture every day I come to work, I put on a suit of armor and I have a shield in front of me. And when I talk to clients, when I do that trauma work and stuff like that, nothing the clients say impact me. So I try and put up like a shield. And I thought, well, what are we doing in law enforcement, first responder work, to prepare a psychological Kevlar shield to be safe? And part of that is that brain flexibility. Yeah. And I borrowed that from my colleague, Dr. Robbie Adler-Tapia, who I work with pretty frequently lately, just teaching that brain flexibility component.
Great. I want to ask about her because I went to her site and I saw her book, and I want to know about the book. But is it do I need to buy the book?
Yes, absolutely.
Yeah.
I jokingly say, but it's true. If I ruled the world, if Nicole ruled the world of policing, day one at the academy, that book would be provided for everyone. And then my second favorite tool we can talk about is a slinky. I would give everybody a slinky. I know you're going to be like, what is that about? But it's about helping our brain settle down and brain flexibility and helping ourselves bilaterally process things. But the book is fantastic. It's more of what I call, it's not just a read book, it's a do book. It has you do work to learn about yourself, to understand your triggers. Let's be honest, the only time law enforcement likes the word trigger is when we're on the range. They don't want to talk about all the other stuff. So it's kind of a workbook as well, but it is educational. Sometimes there's just a disconnect. As much work that we're doing out there to help first responders, sometimes there's still just a disconnect in what is trauma, what is actually a normal response, not just in the brain, in the body. They're connected. What's our physiological responses that are normal, all things considered? What is it normal for the brain? When does it turn into a point where we need assistance? You know, how long, does that happen? It talks about what agencies should recognize, stuff like that. And she does some fantastic work. She's all over the, country doing stuff. And I'll be honest, she'd be a great person for you to meet at some point and talk to. Yeah. I think she'd provide a lot of insight. I base a lot of my work that I do on her work because I've seen the successes. So I teach a lot of her techniques, and she lives not that far from me. I'm really lucky. She's in Arizona where I'm at.
Because I'm a psychologist myself, and I studied recently, I came, for example, to dialectical behavioral therapy with some great tools.
Yes.
And I do a lot with acceptance commitment therapy and also cognitive behavioral. But what kind of tradition is this book written in?
So she is a big proponent of EMDR, eye movement, desensitization, and reprocessing. So she's got a background in health psychology. She's a first responder psychologist currently. She also has another interesting background with children. She actually has written some articles and some books and validated EMDR for children who have been physically and sexually abused. So her work is pretty robust and foundational. But she, at this point, she had first responder background, EMS, stuff like that in her family. And so she started seeing in the community these negative impacts and thought, how can it be better? So part of the work she does intensive 3-day seminars based on her book, One Badge, One Brain, One Life, where it's first responders and their spouses or partners. They come in, they do some really intensive work. They do some EMDR with like immediacy. I went to one of the seminars. That's kind of how I got connected with her in the beginning. I was looking, this is kind of funny. I was looking for something, vetting a program that I could send other people to. And when I'm in the program, I participated, and it was a good reminder, like, hey, don't forget about yourself in the process. You can't take care of anybody else if you don't remember to take care of yourself. So it was a reminder, hey, I'm all about EMDR. I mean, I am a therapist. You just brought up dialectical behavior therapy. I'll be honest, that's one of my favorites. When I don't carry a caseload right now, I don't have time while I'm on the road, but I ran a DBT group and integrated that into individual therapy. And I like it. And I think first respond, I know it's for, everybody's like, oh no, it's for borderline, it's for this. I got it. But some of the skill sets in DBT to me, like distress tolerance. What first responders need? How do I tolerate stress? Everybody needs it, right? Everybody needs that.
And the wise mind exercise, I also love.
Yes, the wise mind. I know I jokingly say first responders tend to be so logic based, which I get. We tend to have this linear career, right? And we're investigating and stuff. So we tend to be so logic oriented. We don't necessarily honor our emotions, but we don't want to be on that side of the spectrum either, and settle right in the middle with that wise mind, kind of honoring both sides of things. So I'm a big fan of DBT. I don't know if everybody else is, but
I am.
have you gotten to looking into my favorite part of it is called radical acceptance? Have you seen the part of that is huge. It's basically like
I also have the book, Radical Acceptance from Tara Brach.
Yeah, so I would take a look at that. I use that a little bit, talking to clients about how can I accept what has happened, understand, it's basically trying to let go of the emotions, accept it as it is. And then, sometimes we do what we call the radical acceptance box. Start little, put stuff in there to be able to let go. You can't put anything in the box you're not ready to let go of, but it's little things, right? Yeah. And then you build that skill set. That's why I like DBT, to be honest. Skills-based therapy. There's not really any processing attached to it. And processing can be valuable, of course, when necessary, but I like it because sometimes people need skills.
Yes, yeah, true. Yeah.
And so I spend a lot of time with the distress tolerance. I think that's really important. That chunk of DBT, I personally think be integrated everywhere, because we all need skills on how do I tolerate more stress? Everybody, honestly, from kids up, like what do I do with that? So I think that's really cool that you got into that. It's one of my favorites.
Yeah, it's so many skills, like and I have to be honest, because when I graduated as a psychologist, I had a little bit how do you call it, resistance against against CBT, because I think I'm not sure why, but later on, recently, for example, I discovered also they have a lot about guided imagery, imagination,
imagery,
and also all those skills, and well, it's great. Yeah,
I'm all about skills. I definitely like I look at CBT, that guided imagery component. I look at similar to performance psychology and sports psychology to a degree. If you want to succeed in a psychomotor task or like whatever that is, you visualize success, you visualize. I don't like the part of CBT where I feel like we're rewriting history.
Yeah, true.
I feel like that part, like we whitewash our own history to a degree, but from the imagery to I can be successful. I can work through this. I am already successful. Imagery is critical. I did that when I went to the academy. I mean, just a specific thing, where you got to jump over the walls and stuff like that. I could get over the chain link, no problem, but I was really stuck on getting over like a solid wood wall. I kept falling off. So instead of kept trying to get up with failure, I took 2 weeks off not doing it and just visualized, right? And to me, that's part of that guided imagery, visualize getting over that wall. I tell you what, when I went to do it, it was probably the best. I felt like a gazelle when I went over it, right? That's the part of CBT I really like. But that skills-based, I just think in the first responder world, we focus, and not even enough or correctly, on the psychomotor skills, but we forget the brain. What about brain skills? What about brain flexibility? And that's where I spend a lot of my time when I am in, if you want to consider it, the wellness side of things, in teaching those skills, brain flexibility, breathing. Breathing's the answer to a lot of problems. I teach Dr. Baldwin's work. That cyclic sigh should be, as far as I'm concerned, integrated into everything at this point for everybody. It's amazing how well it works. And I was happy to share that with her. I think it's fantastic, but we're still stuck. We can't move forward if nobody's heard about the research, right? So we got to be pushing that out there, and it's getting there. But, I usually, when I teach, I ask a class, how many people have heard about it? A couple of people here and there. Well, I make sure they all hear about it by the time they leave the class, so they can use it and teach it. So, yeah.
And how did you came to this topic? I mean, you were for a long time still, you're working on the streets as a police officer. And when did the let's call it for a moment the wellness part of the brain health part, when did that kicks in? Because you are also maybe you became interested in tactics and other. What brought you here to this topic?
So it's kind of I'll make the longest story as short as I can. obviously I got into therapy, and I was still a police officer when I was working as a therapist. I was like police officer full-time, doing therapy on my days off. I did my clinical work when I was still a full-time officer. Some of my clients were regular civilian population, and then I had some first responders, some retired military. But as I transitioned into working with force science, this is really kind of what got me going. What I started to see was a pattern with officers. So for force science, I'm very blessed. I get to teach in human factors, right? So I teach force encounters, investigations, and force encounters. And that entails, of course, human movement and biomechanics and, realities, limitations of human performance. But what I saw in the officers was eye-opening. And what I noticed was when they didn't know the why behind things, and it started there. This wasn't even necessarily a mental health component originally. I started seeing I don't know why I shot somebody in the back. I don't know why I had tunnel vision, right? I don't understand why I can't remember. Like, I have Swiss cheese memory. I don't understand in this event, which I think I should be able to remember perfectly, all things considered. And I started seeing these little psychoeducation pieces of, now I understand movement. Now I understand why I had tunnel vision or auditory exclusion, all these little components. People were struggling sometimes, like they would hear that stuff and they would be overwhelmed just in a class. They'd have to walk out, take a breather. That was the first step. But then I started seeing, I think this is the worst part of it, to be honest, negative impacts from what I call agency betrayal. But, sorry about that, my dog. Let me pause this for just a sec. I started seeing negative impacts from agency betrayal. And what that is, officers, we train them, right? So we train them to intervene, sometimes very swiftly with an application of force. That's judged from hindsight. Video literacy concerns, all of this stuff. And I started seeing agencies, and this is still continuing. We have a lot of work to do in this area. Agencies throwing their people under the bus for absolutely justified uses of force, politicizing things, right? Yeah. What I saw and what some of my colleagues were seeing is people would work through, and I'm just going to qualify whatever event it was. Okay. They'd work through their event, and I'm going to use the word quickly relative to them. That's individual. They worked through that event, but they'd hit this brick wall when it came to my agency threw me under the bus. They abandoned me. They isolated me. Yeah. They treated me like a criminal for doing my job. They stripped people of their identities. I think that by itself is an overwhelming component we don't talk about. When a lot of times in the first responder world, if you ask a first responder, who are you? You don't get mother, father, musician, whatever it is. You get, I'm a police officer. Yeah. It's an identifying component, yeah, right? Absolutely. And then, what do? We sometimes put them in the back of a police car, take their gun away, interview them in the same rooms we're interviewing criminals, photographing their stuff just like they are a criminal, stripping them of who they are, because once you take away the police identity, who are you? Yeah. And for a lot of people, there is nothing else, or they haven't formed a equally strong identity to their career. And it's shattering to people. And so when agencies do that, I started seeing these negative impacts of agency betrayal. And I thought, how we owe people the ability to thrive through this, not to suffer. Yeah. I look at survival in this career as a short-term goal, or even as a human being. Surviving can be that second, that minute, that day, that week. But holy cow, we should be thriving. Yeah. We should be thriving. We owe it to ourselves to be healthy. Yeah. And so that's really when I started seeing that. And, and this is, of course, anecdotally from my colleagues, but there's plenty of research out there already on, sorry about that. Yeah. There's plenty of research on organizational betrayal, yeah, not just in law enforcement, but in general. Yeah. But it's not like we're isolated from that. And so I thought, how can we, at minimum, prepare people for what's coming and give them skills for when they are in that moment with use of force, when they are involved in those critical incidents, when they are treated like absolute dirt by their agency. What are we doing for people? And so that's really what got me going down that road. Because when I would teach, like I said, even in human factors, or even when I mention organizational betrayal, it's like that interaction with the audience, it's pretty intense. Like they're like, yes, like I was involved in a shooting and that was me.
Yeah.
Right. I was absolutely, everything I did was right, but my chief went hands off with me till it was civilly or criminally litigated, instead of being like, my officer did a damn good job and they did what they were supposed to do in that small sliver of time that they had. So weak leadership, if you even want to call it that, doesn't help this cause. And so I got a little frustrated, and frustration led to, we got to do better. And it has to be cultural. This has to be an absolute shift in our culture. And there's pockets doing better and individuals out there doing great work and doing good things, but it is not culturally accepted yet. So that was my biggest frustration that kind of, turned me down that path.
Great. Are you aware of the Mission Critical Teams Institute? Because I talked with Dan Dvorkis. He had a nice phrase. It's about, he said, he's a doctor, of course, but he talked about being a first responder, yes, is to sacrifice a lot, but it's not self-destruction. It can never be self-destruction.
That's right. And I think, unfortunately, self-destruction is the norm. I'm not saying it's intentional. I mean, those are two conversations. But when it comes to trauma in the first responder world, there's a couple of challenges, and I'm sure probably they would mirror that, when you're talking. Sometimes part of the problem is we won't even acknowledge trauma exists. There is still what we call trauma blindness in the first responder community. Everybody goes like this, not just the individual to their event, but people in general. I don't want it to exist, therefore it shouldn't. Or one of my least favorite things, this is what you signed up for. The profanity that want to come out of my mouth to that sentence shall not be aired on your show. It's very frustrating. It's like, we understand what we signed up for. That is a true statement. But that doesn't mean by nature of it potentially happening, we deserve to be treated like dirt. It's not appropriate. So there's that. We can't even agree as a culture what a traumatic incident is. Like, what is actually a critical incident? I think that's frustrating. We pick and choose what they are, not understanding that we should agree from a macro view what trauma incidents are, what critical incidents are, and healing belongs to the individual. Some people may be impacted less than others. Some people may have not much of an impact. Some people are born genetically more resilient as is. Some people have already developed fantastic resilient skills. Some people need some assistance in that. So everybody's on the spectrum, but we can't even agree. We focus on, okay, a shooting, your partner got killed, we talk about those things, but nobody's talking about continuous homicide investigations, continuous sexual assault, child exploitation crimes, drowned kids, SIDS, babies, fatality accidents, severe injury accidents with, a potentially disturbing visual imagery. A lot of that stuff gets brushed off to the side, instead of us being robust and saying all of this stuff and little stuff over time, the cumulative stuff is a problem. I mean, there's still colleagues of mine who say there's no research that says first responders experience post-traumatic stress at a higher rate. There absolutely is research that says that. And it's not just PTS, right? It's physical considerations. Look at the cardiac events. Look at cumulative stress on the human body. We can't even get some agreement on those kind of things with big funded research projects. So that was a kind of all over the place thing to say, honestly, we just need to do better. I think it starts with education, but it needs to be, and I think this is the point that you hit on the best, it's integration of these skills and training. My biggest frustration is we talk about resilient skills. We talk about them. Well, I could talk to you for the next 10 years about playing piano. That doesn't make you a piano player. We need to integrate breathing, integrate how do we dampen our physiology outside of our workday? What are we doing to make our brain flexible? What am I doing with pre-event? What am I doing post-event? How are we supporting each other through that? How are we making better processes that actually don't instill trauma? Part of trauma is isolation. What do we do to officers that get involved in critical incidents? We isolate them from that's their work family, right? Their friends. We treat them like a pariah. Well, if you want to instill trauma, start there.
And how can we do if we take this very concrete example, if I understand correctly, critical incidents, like I'm involved in some kind of, for example, in the shooting incident, and then the whole process starts with interviewing me, with separating me, and so on. Is that what you mean with the critical incident?
Yes. And then past that, like when we put them on leave, you're not allowed to talk to anybody. You're not allowed to this. Now, I understand. I want to separate one thing. Any use of force requires an accounting for that use of force. That is what is necessary. We have to explain the reason behind the use of force. That belongs here for a moment. I'm just going to set that here. I'm not saying we don't explain it. I'm saying we need to understand the realities of a human being in total and stop removing the human being from a human experience.
Yeah.
We expect officers to be robotic. We've trained them perhaps how to be in an interview that's not realistic. We put expectations on them that nobody can meet. And I would say that that impacts military as well. It's anybody that's going to be involved in these potentially critical incidents. And we place expectations on them that no one can meet in that moment. We ask a lot of people in that moment they could die.
Yeah.
And it's not realistic. You should have a perfect memory of this event. You should be able to explain everything. You should know how many rounds you fired, steps you took, strikes you did, this, that, and the other thing. Not going, well, what does research actually say about the memory under stress, right? What does that look like? What are the realities? And hold somebody to the realities, not an unreasonable expectation. So a reasonable expectation would be what? You're not going to remember everything perfectly. You can't. That's not how the brain works. We don't remember everything perfectly when you and I are sitting here, right? We're going to remember bits and pieces of this conversation, the overall gist of what you and I talked about, and maybe something that was super important. Like I'll probably remember absolutely the discussion on DBT we had. I love DBT. You seem interested in it. That will stick out to me.
Yeah.
I'm going to remember everything perfectly, but we don't talk about that. And I always tie it back when I teach this component. I tie it back to sexual assault investigation. We use, hold on one second. Sorry, Eric.
No problem.
How does it going this morning? We used to treat sexual assault victims awful, right? We used to say, well, you have been sexually assaulted, you've been raped. This is one of the most overwhelming things a human being can experience. Of course, you should remember it perfectly. You should remember what they looked like, everything, that whole event, because holy cow, it was so emotionally impactful and physically impactful many times. Why wouldn't you remember it? And so when there was inconsistencies or Swiss cheese memory or all this kind of stuff, we're like, you're a liar. You're a liar, right? Take the you're not the best victim or no jury appeal out of it, but you are a liar by inconsistency. Well, let me tell you what has not changed in law enforcement is you are a liar by inconsistency when inconsistency is the norm. And that is what frustrates me. So what happened with sexual assault victims? We morphed our investigative techniques. We started to build interview skills that were more reflective of that population, of what they experienced. We got into trauma-informed interviewing and how can I frame questions that are not inappropriate or leading or whatever that is.
Can you give an example of trauma? What are the trauma sensitive
interviewing? Basically, it's softer interviewing skills. So it's asking questions that are not leading. They don't basically affect the brain. They don't tug somebody down a path. They're not harsh. They don't instill additional trauma. One of the primary questions we used to ask, and this is really, really unfortunate, we've removed this one, but it's, what were you wearing? As if your clothing has anything to do with you being sexually assaulted. The sexual assault behavior belongs to the perpetrator, not the victim. You were drunk, therefore it's your fault. So instead of that, we understand what questions are appropriate, what are not appropriate. But where we haven't changed that, to be honest, is law enforcement, internal affairs investigations. We ask leading questions. We ask, it's more done as an interrogation versus an interview. It doesn't take into account memory considerations of traumatic stress and, what an officer may remember. It doesn't take into account, and this is part of understanding investigations in general, not necessarily a trauma-informed component, but it doesn't take into consideration limitations of video, what we hold people accountable for on a camera, stuff like that. So trauma-informed interviewing and another style of interviewing, cognitive interviewing, at Geiselman's work, it's designed to eliminate something called memory confabulation,
Mm-hmm.
which is basically a distorted, altered, or false memory with no intent to deceive. Our brain likes to fill in the gap.
Yeah.
Find me overall, not individual. Find me overall who's been trained in trauma-informed interviewing, cognitive interviewing, forensic interviewing, different interviewing styles. Nobody gets trained when they go into IA. It's usually just, you've been here long enough, move over here. Or a lot of times it's homicide investigators, and I'm not taking away from their skill set, but it's not good enough. If I had to pick, it would be a sexual assault investigator versus a homicide investigator to go into IA. Why? They have usually, ideally, different style of interviewing skills than an interrogation. It's no secret who killed somebody in a critical incident in law enforcement. You're not trying to trap them into saying it was me. We know. Why is it an interrogation?
Yeah.
So that's part of it. You know, the one question, how many rounds did you fire? How many different ways can you figure that out without asking the person who may not know and more likely won't know? And if they do know, you can give them a high five. That's fantastic. I mean, but that's not the norm.
No.
In a threat, I would not expect somebody to be counting rounds or counting steps or, you know, being able to tell me what their partner did, you know, when they're trying to stay alive. That's absolutely asinine. It's asinine.
And are you everything you talk about right now, are you teaching this in a course? And if so, to whom are you teaching this?
So law enforcement and some attorneys. So obviously when I teach for Force Science, I do teach force encounters investigation. I weave a lot of this in. It's not a standard part of the course. This is my background, so I talk about it a lot.
Yeah.
My boss, Vaughn Kleem, you've probably talked to Vaughn at some point. He and I do some, if you want to call it, specialty classes that talk about this. So we teach a class called Cops Aren't Cameras, and we talk about those components of realistic stuff. I do a class called The Investigator's Role in Trauma Mitigation. So I've done that across the country, and, you know, some keynotes, some specific conferences. That's not one you can click on the Force Science website. But if people reach out, we can accommodate those things. Yeah. So I'm also, Dr. Robbie and I are working on some stuff about integration for therapists, understanding human factors, because first responder therapists, if they don't understand human factors, how can they truly understand first responders, even with the best intent in mind? So Force Science is, I'm very lucky that they support some of my wellness initiatives. You know, they allow me to go talk at wellness conferences, and I get to do some very.
Can you talk also about that, about the wellness? Because if I'm correctly, this the before we talked about force investigations, interviewing, and now the wellness part. What are your not what are you teaching? Yeah, maybe what do you want to educate
wellness,
people with regard to wellness? Eh?
Sure. 1 second. Let me look her. Hey. Sorry about that. She wants to be part of your podcast.
Of course.
So with wellness, like I said, I focus more on what I call brain flexibility.
Yeah.
But any wellness course, basically, I want you to imagine we do some education about the realities of trauma and stress. What are they? What are the differences? How do they impact the brain? We talk a little bit about, well, I do, I guess I can say when I teach, I talk a little bit about post-traumatic stress as an injury. I do believe it's an injury. Nicole doesn't have to believe it. Let's look at research. Don't believe Nicole, right? There's countless research on restoration of the brain from post-traumatic stress after treatment, to include EMDR, right? Because when we have, and I'm not giving anybody a diagnosis, whether they have post-traumatic stress, whether they have subthreshold PTS, whatever it is, your brain fires differently.
Yeah. There's
more than enough research. Dr. Violante's work is critical in that. Having post-traumatic stress impacts decision-making negatively, because that rapid processing part of the brain. But with treatment, what we see is those areas that are firing too much and the areas that aren't firing enough. If you look at the SPECT scans from the Amen clinics, you see restoration of the brain, right? Yeah. So I talk to people about how it's an injury, no different than if you blow your knee out, you know, you have surgery. The worst part sometimes of the injury is the rehab.
Yeah.
Right? You hate your physical therapist, just like you might hate your actual therapist in the mental health world, right? It is going through those things. So I talk about the reality of trauma, and then I spend a lot of the time in the resilience skills, building grit. what can I do for myself every day in that moment? So of course, at this point, because I know of Dr. Baldwin's work in the cyclic psi, I integrate the cyclic psi into all my teaching and teacher technique. I teach box breathing with a bilateral component. What that means is not just the regular 4-count breathing. We talk about incorporating eye movement, following a rectangle, okay, around to incorporate what we call bilateral stimulation, bilateral processing.
So can we just pause here a little bit? So I'm doing the box breathing.
Yes, I can demonstrate it if you'd like.
Yeah, of course, yeah.
So I want you to imagine that, well, we can just use our computer screen for this one, right? I want you to start at the lower left-hand corner of your screen. And traditional box breathing is like inhale for 4, hold for 4, blow all that air out and like do a reset. So I want you to imagine while you're doing that, as your eyes are at the lower left-hand screen, as you're inhaling, I want you to move your eyes up to the top left. As you're holding your breath, move your eyes over to the top right as you blow your air out. So you're making a rectangle. I just want you to imagine during that process, you're like up, hold, over to the right, down to the right as you reset back to the left. So you're adding just, I want you to imagine you're just following a rectangle. Then that's step 1. And that incorporates that bilateral stimulation, bilateral processing component that helps the brain settle down. Let's just leave that.
Sorry to interrupt you because.
No, of course, go ahead.
Yes, because we have, of course, the bilateral stimulation. You can also do the tapping and whatever.
Tapping.
But there is also the how do you call it? The horizontal look. I always call it panorama vision from Andrew Huberman.
Yeah, Huberman's work is pretty fantastic, right?
And but the
EMDR does a lot of that. You know, I know you can't see my eyes per se, but like, and I'm saying more like the traditional therapy has like light, you follow lights right back and forth at a level that, if you want to say, is just beyond your comfort level of eye movement, right? So you have to kind of force that. So the movement of the eyes is critical. If you look at that, it's definitely part of the, I would say, EMDR process. But before we go back to the box breathing, but like following a tennis ball in a tennis match, you can get more basic bilateral, right, in eye movement. There's plenty of videos on YouTube, honestly, like where you can follow, you know, like follow a ball or a wave, and they have it go up, down, you know what I mean? And like you could just type in like bilateral stuff for that.
But in EMDR we use it to, you know, to how do you call it, to use the working memory and to lower the emotional how do you call it, attachment to the.
I want you to imagine a couple of different ways with EMDR, because so with EMDR you're of course incorporating, let's talk about just the bilateral components, not the little therapy part of it for a second. So normally you incorporate all of these things. You have the eye movement, right, the back and forth. You usually have maybe headphones, you know, headphones in your ears for stereo audio, right? So it's back and forth. It's also bilateral. And then a lot of times you have tactile sensors on your hand. So when you look right, the sound is right, and then you're pressing the tactile sensor. So I know I don't have headphones on, but basically it'd be like right, left, you know, whatever that is. That is designed along with the therapy to basically help. I want you to imagine, I look at stuff like your memory of a critical incident, your emotions are stuck together. They're on the same track. We're not here to brainwash people. We don't magically forget things, but the goal is, can I have the experience without the emotion? Can I separate it back where it belongs, just like we do other things? So that bilateral stuff can help drive down physiology, you know, breathing techniques, diaphragmatic breathing, the cyclic style, that kind of stuff can help, you know, regulate, dampen that amygdala response, regulate some of that stuff. If you actually have a cortisol response in the body, you know, I want you to imagine with immediacy, it can attempt to dampen some of that cortisol response in that moment. So drive down that heart rate, blood pressure down, stuff like that. But in the memory component, you know, part of EMDR, I don't think that's talked about enough, is you're not remembering the event. You're remembering the last time you remembered the event. You know, it's not going back to the initial event. Every time you remember that event, it changes, right? Your brain, I mean, and that's just the brain in general. Our memories are like that, right? So when you're remembering it, it's the last time you remember it. You're extracting that. You're not going, oh, holy cow, I'm going all the way back. So I was probably a little.
With the box breathing, the goal is relaxation. It's not working trauma out, or is it?
No, the bilateral component helps trauma not settle in the brain. That's what we're trying to do with the added component of bilateral processing, right? We want to dampen that amygdala. We want to see some things that don't. So you can box breathe without all that. That's the traditional way most of us have been taught. Now, if you look at Dr. Baldwin's research with the cyclic sigh, that has some that is more effective in the physiological components, right? Just in dampening the physiological components. So to me, this is what I would do. I use the cyclic sigh, like when pre-event, I teach it to people. Immediately post-event, maybe you're driving to a call. I mean, imagine you're a brand new officer and it's your first active threat, active killer. And maybe you're feeling all, you can hear the therapist in me coming out. You're feeling all sorts of ways about that. You're starting to get a little amped. Let's, do a cyclic sigh. And we try and dampen that before we get to the call. Now, the box breathing with the bilateral component, the goal of that is to help trauma not set in by adding the bilateral component to it. And so there's another layer to this where when you're engaging in the box breathing that we talked about, and I can send you a handout, if you want to post it to your viewers. And then basically you do what you pair it with what we call a cue word. So in this event, I'm just going to pick a word and it's the word calm, or you could pick relax, something for you, whatever that is. When you're doing that box breathing, you also think this word, right? So you think calm. And you think that word and you pair it together. We're training just like we train the body. We're training the brain to go, I'm going to do box breathing. Holy cow, diaphragmatic breathing is helpful anyway. Holding that breath, is letting that oxygen get absorbed into the alveoli. I mean, this is no different than some of the techniques we use for COPD and emphysema, right? We want our body oxygenated, right? So holding that breath, forcing that oxygen to be absorbed, blowing it, kind of like blowing it out through a straw helps also with that. So we have the physiological component, the bilateral eye movement. Then we pair it with a word, calm. So you're training your brain in that moment to think every time you think that word calm, you're also training your body to dampen that physiology. It's like a layer, right? It's like a layer. Then that you can add one more component. And so when Dr. Robbie and I teach, we hand out little like paracord bracelets and we put essential oil on them. And I need to make this clear to everybody listening, 1 drop and 1 drop alone. You put any more of essential oil on yourself, you're going to smell like you rolled out of a you don't want to be in, right? And the whole room's going to be pretty challenging. So 1 drop on this little paracord bracelet of something that we like. And why is this important? Well, imagine in the first responder world, this already happens. We have negative pairing with odors, right? We don't like to smell of decomp, brain matter, certain things, whatever it is. Odor and memory are powerful, right? So let's use that to our advantage. Let's reverse it. So you pick an essential oil, put it on your bracelet, wear this puppy every day. Essential oil lasts for a while. I'm just going to use, for example, like orange, a lot of people like the scent of oranges. So when you inhale, so I want you to imagine you're starting this exercise. Now you pair it with an odor, right? Pair it with an odor. So now you've got the breathing itself, the bilateral component, the cue word, and that lovely scent that we pick, right? Pretty soon, what happens is you're going to pair this scent and you're just going to be able to go, right? And your brain's going to go, oh, hey, I recognize that. Just like we do with other stuff. I can start to. So it's kind of I look at it as a failure.
It looks very much to classical conditioning, isn't it? Or operational conditioning? Or
I would say you could probably put it there. Yeah. And because you're conditioning your brain.
Yeah,
but I like
all those the associations. Yeah.
Yeah, I think officers, they kind of hear, oh, I'm getting conditioned. They start thinking of Pavlov.
Yeah, of course. No,
I say go past that. What you're doing is integration of a skill, just like you are with firearms, right? So you're just integrating this. So you learn that. And how I teach it, for example, when I do it, I demonstrate it to the class, right? I have the class participate with me. And then I usually ask a couple students, teach me back. Because even as a therapist, if I'm teaching somebody a coping skill, whatever that is, when they leave my office, I want to know they can do it. They can do it. Now, doing it once they leave my office belongs to them, just like the officers that I teach, first responders, doing these things belongs to them.
Yeah.
I can only go so far. I can't be there and breathe for them, right? But then it becomes, when are you going to do this? Well, you need to start doing it when it doesn't matter. You need to do it when you're calm. You need to do it when it could be, you get aggravated. It could be something so simple. You go to get a soda out of the machine, you put your money in, your soda doesn't come out, you get a little irritated in that moment. You wanted that soda, you know, it's so goofy, but you get a reaction to it.
Yeah.
You want to punch the soda machine. Instead of that, start your breathing then. Start integrating that cyclic side. Start doing that stuff, right? Start having the conversations on the training level, right? Where two people could be in a car, a trainee and FTO, or a two-person car, who's ever lucky enough to have that out there, right? Two people in a car, if that even exists. Where you notice somebody's chest breathing, right? They're a little nervous. You hear the, you hear that chest breathing. We laugh at it when we see it on videos, but let's be honest, that's a problem.
Yeah.
It's a problem. We're stressed.
Yeah.
Instead of being like, hey, you moron, you need to fix that. How about let's breathe together?
Yeah.
Hey, do me take a deep breath with me.
Yeah.
One more, blow all that out. And we normalize that it's okay to feel like that. It's okay to get an adrenaline dump. Like we try and elicit that in training, right?
Yeah.
We try and get somebody to a level of some level of acute psychological stress. Or, well, let's not throw it completely acute, but a level of psychological stress, because we want them to learn how to manage it.
Yeah.
Well, how are we going to manage it? That's what we're skipping. Why aren't we breathing when we train people? You give them a dispatch. Okay, you're going to a movie theater, active threat. There's a shooter inside. Why are we not saying this is the part where you breathe? Let's breathe on the dispatch. Yeah. Let's breathe now. Yeah. Okay. Get done with your use of force event. What do we normally do in law enforcement? We're like, high five, you passed, or no, you need to redo it again. Instead of, we create scenarios with a great stress response, adrenaline dump, jelly legs, all that kind of stuff. How about, what are you going to do with all that? What are we going to do with it? You still got another call to go to. How about this is an area where you breathe?
Yeah.
So we have to integrate it into the training process. Yeah. And a lot of times we fail to. But if we don't normalize that, or at minimum, kind of drive that home, like with some of our other stuff, we can't expect it to people to do it.
Yeah.
If we're not giving them the opportunity to train it. And this doesn't add training time. I mean, really think about it. We can teach coping skills in 15 minutes.
Yeah.
We design scenarios all the time. People have to go through training at some point of the year.
Yeah.
So you add it to the training when, right? People have to obviously, of course, decide to practice it. Now, that's my bigger hurdle. I'm going to be honest with you. I think you know this. We have people who only shoot at qual. They never shoot any other time of the year. Practice their defensive tactic skills, like, or whatever it is. It's like once, never, yearly. Okay, that's not a foundation for success in psychomotor skills, in anything. So if that's all we do, the officer, like, we have to tell ourselves, this is important enough, I need to practice.
Yeah.
And I tie it even, Eric, to de-escalation, right? Think about that. De-escalation will not be successful if we cannot self-regulate.
True.
So if nothing else, we start there. You got to be able to self-regulate to be successful, right? Yeah. And another thing I tell first responders, there's only one person at your call that's paid to self-regulate. And holy cow, that would be you.
Yeah.
It's you.
Yeah.
Like, you have the obligation. You took the job.
Yeah.
So we don't get to be all sorts of stuff. Now, we're human, so it doesn't mean we don't have that. It means we should have the responsibility to regulate it.
Yeah.
That's it. To figure out how we can be more successful, or responsive versus reactive. That's where we'd rather be, and self-regulation is part of that. So there's breathing. I teach grounding techniques.
Can you give me an example of a grounding technique? Because
sure.
recently I came to.
Don't judge me on this energy drink that I'm using in this grounding technique. Yes, I'll give you one. Go ahead.
No, recently I as a martial artist, I learned about grounding for a very long time, but I didn't pay any attention to it. So lately I saw some real research, some real hardcore research about grounding, even about grounding like with your feet on the earth, but also other grounding.
There's fantastic. So one, that's a great study. So I know the one that you're talking about, barefoot, standing in the dirt. Yeah. It blows people's minds. They think it's a whole bunch of crystal crunch or woo-woo stuff.
Yeah, no.
But that grounds you to the earth. And that is shown with research to help get people back to their established baseline. And people just lose their mind. But I mean, honestly, think of society. Remember when we were kids You and I are fairly
Yeah.
close in age. Back in the day, we played outside. We're running around barefoot. Like, I want you to imagine differences in some cases of mental health of kids who got to be outside playing that, actually ground, compared to that is not as common anymore. But that research in and of itself. So, I mean, everybody listening, you want to take a few minutes, go outside, stand barefoot in the dirt. And I'm in Arizona. You got to time that to the time of day. Huge successes, right? But a simple grounding technique that I teach people, and I'm going to talk about meditation separately. I said, like, I'm going to get judged on my energy drink. Nicole is telling you, don't be an energy drinker to excess. But I want you to imagine this is a hot cup of something. It's going to be hot, and it needs to be something you enjoy the smell of. So if it's coffee, peppermint tea, hot cocoa, chamomile tea, like whatever that is. So you fill your cup, and what I would encourage you at this moment, you have to be alone. I want your phone not with you. That's a whole separate conversation we can all have about our phone and anxiety. But I need your phone not with you. You're in a room by yourself, no dogs, no cats. If you got a little chirpy bird, like, you need to be somewhere alone and quiet. Okay. So you have a hot cup of, I'm just going to use, I love the smell of coffee. I pour myself a cup of coffee, not scalding, warm enough, you know, not too hot. You can't drink it, but it's in your cup. And I want you to sit with your hands around the cup, close your eyes, and just take some big, deep diaphragmatic breaths. Like you're filling that belly up in the diaphragm, not in your chest. And you're inhaling through the nose, blowing out through the mouth, and really inhaling that scent. That's why it has to be something we like. And no, all first responders, everybody asked me this questions, no hot toddies, no alcohol in the cup at this moment. So you can't have that. So you breathe, you know, in and out a few times. I want you to feel the heat of that cup on your hands. When you go to take a sip of that coffee or tea, I want you to swish it around in your mouth. And when you swallow it, I want you to feel every moment of that going down, right? Your esophagus and your stomach. I want you to take some more deep breaths. You know, it's something that simple. It takes 30 to 60 seconds of our lives right now. What I can tell you, if you don't ground in any way, shape, or form, your brain doesn't want to play even for 30 seconds. You're going to notice you're going to be sitting here and your brain's going to go somewhere else. Even sometimes in those first couple seconds, you're not used to it. Pull that brain back, be here, right? I jokingly say to people, be one with the cup. This is 30 to 60 seconds of your day. The effect that has on physiology and brain health and stuff like that, you can't be depressed of the past and anxious of the future when you are here in the present. That helps regulate the body. Like, it can help your neurotransmitters. It can help your cortisol levels. We'll talk a little bit about cortisol and exercise in a second, but just this. The thing is, I need first responders to understand, don't do this in your patrol car. Don't do this parked somewhere. You need to be safe when you do this one. Nobody can come up, knock on your window, anything like that, right? So now you can do this at work. And here's the thing. A lot of people have an overlap in shift briefing. You know, do it in shift briefing. And everybody's going to laugh and think it's stupid and funny, but it's funny till it's culture. It's funny till it's culture. And then it's, holy crap, we don't have time for our grounding today. It's 60 seconds, guys. Like, you can't take 60 seconds of a day, you know, do this when you get home, stuff like that. That's the most basic one you can.
And can you give me, I'm looking for a definition of grounding. The example you give looks a lot like mindfulness, being in the here and the now. There was recently a great paper by Ethan Cross from the book Chatter. He talks about sensory emotion regulation, just by your, how do you call this? The eyes, the ears.
With your senses. So
with your senses. That's what you're doing also, isn't it?
Yeah.
You're using
First
your
responders
senses.
Don't like the mindfulness term very much.
No,
I'm just being honest. It's over, and you know, and that's okay. Because bottom line, I don't care. You could call it tactical mindfulness, to be honest.
Of course,
But yeah, so being present with your senses. There's another exercise you've probably heard of. It's basically a grounding technique of the 5 senses. When you are grounded in your senses, you are present.
Yes.
Sensory memory is not very long. Really, I want you to think, like, really, we're bombarded all day long with stuff. Sensory memory is pretty short compared to all memory. But what you're doing is you're taking that time to focus on those senses. When you focus in the now, when you focus in the present, and yes, for those of you who do like the term, when you are mindful of being in the now, it is to the exclusion of anxiety, depression, all those things. And the thing is, we're feeling And I'm not saying everybody's anxious and depressed, don't take that, but we're still feeling all sorts of other stuff all the time. This, I also want you to imagine as a first responder, this is something you have control over.
Yeah.
This is you, you're picking this, you're choosing
Yeah.
something, right? We like to exert control. Part of helping the brain settle down, part of actually trauma mitigation is feeling like I have a sense of control over something.
Yes.
So you're picking this, you're choosing it. My mental health is important enough to me. I'm going to do this.
Yeah.
And real quick, just to touch, because you brought up the sensory stuff, there's another technique basically that incorporates, we have a lot more senses than 5, but our basic 5 senses, that basically we focus on that. And I can give you an example, and you can do this while you're driving down the road, for example. You're starting to feel a little whatever it is, and you want to bring yourself back into the present. You can tell yourself, identify 3 things I see.
Yeah.
Right. So this one, this is the one I think most people are familiar with.
Yeah.
So you can drive down the road. I see a street light. I see a pedestrian. I see the car in front of me. 3 things I hear.
Yeah.
I hear my radio.
Exercise.
You know, I hear myself breathing. I hear my tires on the road. I kind of tend to, while I'm driving, because we can do this one pretty easily when we're driving, I tend to focus on sight, hearing, and tactile. So 3 things. I feel, you know, the car seat under my butt. I feel my foot on the pedal. Like if I'm driving, I feel my elbow, you know, whatever it is.
Yeah.
You can incorporate smell and taste. But if you're driving down the road, like how much are you taking? Unless you've got gum, unless you've got something, or you are going to incorporate, you know, and you can smell the same things. I smell my bracelet. I smell this scent, and it could be the same thing. I don't care. So you can incorporate taste and smell, but that is grounding you in the moment. Like you're right there.
Yeah,
you know, if you're identifying, like I see a lamp, I see my computer, I see my energy drink, right? I see those things. Here I am with you right now in this moment without all of this.
Yeah, great.
And that's why I focus more on grounding than meditation. It's not that I don't think meditation has benefits, but what I do realize working in trauma is meditation and longer term meditation. Like if we're asking, hey, meditate for a half hour, meditate for an hour, has some really negative impacts on people. If we have unmanaged trauma, meditation tends to have a very negative rebound effect. Your brain doesn't know how to be safe. It hasn't figured it out yet. So as you're trying to pull it down for a long term, expect problems as it rebounds back. It doesn't mean there's no value. It means you need to make sure that your brain is healthy and ready for something longer. And I think in some I want to say programs or whatever it is that are very focused. Oh, with mindfulness meditation is the answer to everything. Not so simple. Not with trauma. Not with trauma.
There are contraindications.
Right. So I just think that needs to be brought up to people. And they also need to not beat themselves up when they're sitting like with this cup and their brain is going, oh, I got to be at work in an hour, right? Pull your brain back. It's no different than training your muscles. Right. When you start lifting, you don't start squatting 600 pounds. Like you got to start somewhere, right? So you got to start and tell yourself, this moment belongs to me. Pull it back, pull it back, pull it back. So little stuff like that. And then also mentioned martial arts. Look at the research. Like there is probably no better martial art that exists than jujitsu for grounding. For grounding. Right. You're in that moment. Doesn't mean you're not with other martial arts, but there's some research on jujitsu that is very mindful. Right. I had
a beautiful woman writing a chapter in my book, Anna Perkel, and she's also a trauma therapist, and she trains Gracie Jiu-Jitsu, and she talks about Jiu-Jitsu for trauma. It's such a beautiful. Do you by the way the book Trauma Informed Jiu-Jitsu by her and her mentor? It's such.
I didn't know. Book. I know of I didn't realize who wrote it off the top of my head, but yes, I think that's fantastic. You know, and if you hear a lot of even first responders go, or people in general, when I go to jujitsu, I'm just there in jujitsu. You don't have to know it's mindful. You don't have to know it's grounding, right? But I go because everything else is so crazy and chaotic in my life. But for an hour that day, or for 1 hour that day, I'm right. I can't be anywhere else because let's be honest, what happens if your brain's somewhere else in jujitsu, right? So a lot of people, right? They're more purposeful in it because they know where they have to be in that moment. So again, it's also choice. And then of course it's time we have some physical exercise components because we can't overlook, we got to focus on brain health, but there's a tie-in to physical health and brain health. But I just want to tell everybody listening, you know, it's a free app. You don't have to pay for it. Most people have heard of Lumosity. It's a brain games app. You don't have to pay for it. Nicole doesn't get kickbacks on Lumosity here, but what it has is brain flexibility exercises. One thing we tend not to be as great at as adults, and I joke, is basic 5th grade math, right? We know our addition, though. We know our times tables and basic division, but it's something we don't do. There's an exercise on Lumosity. It's about basic math where it's raining math problems. It's 2 + 2 and 7 × 3 and everything like that. And if they drop to the bottom or you answer it wrong, water starts to fill up. Okay. And if finally, if it gets too high, the game ends, right? But this isn't complex math. Okay. But it is helping instill brain flexibility, stuff we don't normally do. So when it's raining math, it's not designed to increase stress. It's designed to, can your brain be flexible to go among these math problems?
Yeah,
right? It's so simple.
Yeah.
It's stuff like that. So there's brain games out there for flexibility. Because let's be honest, what does law enforcement hate? They hate change. They hate it, right? They're not adaptable. We want people to be adaptable, right? That is part of a healthy brain. Inability to change is not healthy. Inability to roll with the punches is not healthy, right? So we need to become more flexible. It doesn't mean you have to agree with change. I'm not saying that. That's a separate conversation. But it is, that absolute resistance is sign that your brain is not where it should be.
Yeah.
So it's little things like that. Lumosity, like I said, I don't expect people, you don't have to spend a lot of money. Now, this.
Yeah, tell me about, I have 2 more questions because then my girlfriend is coming home. I want to know about this. I have another question. I want to get some feedback from you on the protocol I developed.
Okay.
But let's stay with that. But first,
my Slinky. Honestly, I got my Slinky at Walmart for like $2. So yeah, I should have bought stock in Slinky as much as I talk about them. This is a basic form of bilateral processing. Okay. Now walking is the ultimate form of bilateral processing that we do as humans. But let me tell you what we don't do when we're aggravated or ruminating or stressed. We tend to sit and stew. Yeah. First responders included. We sit in a chair, and I'll be honest, a lot of times we don't realize it, but we're dissociating. It was 2 minutes and now it's an hour. We weren't sleeping. We don't know where the time went, right? We're just stewing and we're stuck. Dissociation is more common than people would realize in the first response. In humans, we're just like it's an ultimate protection thing, but you're not sleeping for those minutes. Your brain is just gone, like you're gone. So what do we want? Well, you're gonna stew. I got it. Your brain is your brain, and we don't have complete control over everything we do. But what I would ask you to do, well, one, if you'll get up and walk, if you would get up off your butt and walk, and you can still think those same things, but if you get off your butt and walk, you're already engaging in bilateral processing, right? But if you won't, do this for me. Think your thought and do this. Yeah. As a therapist, I keep these in my office. And you know who uses them? It's not the kids, it's adults. Why? Because when I get stuck, this helps me separate some of that emotion, right? It helps my brain split on something. And so I wasn't kidding. Everybody in the academies will get this. To be honest, if I ruled the world, and this will be an uphill climb for me, when we're doing internal affairs investigations, just like I put in the offices of sexual assault victims, fidget spinners, tactile cubes, stuff like that, your IA office would be filled with those too. Your officers, I'm not assigning victimhood. Okay, I'm not. That's not my role. But this is what I'm telling you. When people have a critical incident and they experience trauma, they are a victim in that moment, right? And we interview them like they're suspects. If we treated them in the manner they deserved, your IA would allow them to pick this up when they're stuck. Play with a fidget spinner. That doesn't make somebody a liar, right? It means they're doing their best to talk to you in that moment. But we do it for victims of sexual assault, and we do it for children, and I think an officer who just watched their partner got shot, who just watched their partner die and almost got killed themselves, they deserve a therapy dog in that office with them if they want it. And why wouldn't they? I mean, and that's the little resistance stuff. So the Slinky is just part of basic bilateral processing. So I would just ask people, to incorporate something like that, into their regimen.
Yeah, great.
And then you had another question?
Yes, but I have a question, but first, there was also a beautiful DBT technique called opposite action, which I sometimes also use. So if I'm stuck on the couch and, you know, feeling depressed and whatever, I just try to, you know, like to smile, to stand up and to do the opposite thing. It's also
Yes.
remarkable. Yeah.
There's one technique, and I can't remember the name of it. And you might have, because you just read about, where when you're in a really angry, crappy mood, I didn't think this one was going to work. So I need you guys to understand this. There's techniques I look at face value and go, not a chance. But I try them, because if I expect my clients to do them,
Yeah.
right, then I should try them. So there's one, I'm not going to stand up, but I want you to imagine I'm standing, my feet are together, I'm really grounded, and my hands are like down. So they're all the way down the sides, but my palms are turned out. So you're standing with your arms down, your palms are turned out. And the technique is to take a big breath and just smile.
Yeah.
And okay, so, and I can't remember the name of the technique, but I'm like, I'll be honest, I looked at that technique and I go, this is the biggest load of malarkey I've ever seen in my life. Then what I started seeing, people would come to group therapy, we'd be on the block that teaches that technique, and they'd be like, that really worked for me. And I'm like, really? Okay. So I started trying it. I'm not saying it works. No technique is perfect for every time, right?
No.
Holy cow, putting your shoulders back, right? Those big, deep diaphragmatic breaths are helping. Turning your palms out, taking a deep breath and just smiling. And it doesn't have to be a big shit-eating grin, right? Just do it like a little, almost like a smirk. You don't have to like show the teeth, but something, holy cow, successful, more successful than I ever thought was going to be true.
Yeah.
Honestly. So it's little that you, like, we're choosing to exert. I think part of that, like the opposite action that you're talking about, we're choosing to exert some control over what we do.
Yeah, true. Exactly.
And I think the one other thing I just want to mention before you go on is the research on depression shows that exercise is what treats it best.
Yeah. Not
pills. And I value when people take medication. I do have a saying in therapy, no pills without skills. I do believe in that, except for what sometimes somebody needs some pills to get stable, for them to engage in all the other techniques that will make them healthy. So I look at stuff, some first responder treaters, I think, are too negative on the medication component.
Sometimes you need it. Yeah.
Forever. But this is my bottom line. I meet you where you're at. If medication is helpful for you, then holy cow, take your medication. I don't, and then can I give you skills to help you be better? Ideally, sure. And just to clarify for people who don't know, I'm not a prescriber. I would work with a psychiatrist to do that, not a prescriber. But people are at where they're at, right? But for depression, the research consistently over and over and over says exercise is what's best. Exercise. Now, that sounds really simple. Go exercise, except people experience levels of depression where they don't even want to brush their teeth. They don't want to, I mean, their hair gets completely matted. They don't want to roll out of bed. So it's not as simple as go exercise.
No,
but for you who are healthy enough, you get to mitigate a lot. Exercise, changes your dumps your cortisol, helps reestablish, homeostasis in the body. I just think we need to remind people it's not always therapy by itself or pills by itself or everything. Like, this is an integration, but don't overlook the value of physical health considerations in keeping your brain healthy. Cortisol is really bad on the human body. Cortisol is one of the worst things that ever existed. It's the best thing in the moment of dying, right? If you think you're going to die, you're under threat, cortisol is your friend, saves your life, survival. It has no other benefit, healthy benefit. And people are, whether they take prednisone or their amygdala is always a little up. I just want to set that tone is, don't forget, you can make a big change in your life. It's contrary to sleep science in a degree, but they tell you don't exercise before bed. Got it. But as a first responder, if you exercise after work versus before work, you've made a change in dumping cortisol, right? Don't dump it before you go to work. You experience the cortisol fluctuations at work for those calls. So exercise after work, dump your cortisol differently, right? So I just want to mention that so people don't forget the value
and more in general, I rediscovered the concept of behavioral activation in CBT, which Andrew Huberman calls mood force action. And it for me, it works great just to get in motion, and thoughts and emotions also follow that, like, can I ask you one more question?
Of course.
Yeah. I would love to talk for 2 hours, but I have to make a pizza for my girl.
I love it.
Yeah, I have promised it her, so I will do it.
Oh, I like that. Follow through is important.
Yeah, follow through. yeah, I have one question, and it is with regard to. I have studied critical incident debriefing, or give it another name. So an officer has intense experience, if it's in training or it can be in real life, and then the debriefing part. And there was a time where we asked the officer about the emotions. There was a time where we asked them to go chronological through the events. Then there were some research. No, not talking about it. I currently work on a project for the military, where if a soldier freezes, what to do or not to do. But I'm a little bit confused right now. So let's make it a little bit more narrow. Say in training, an officer experiences an intense moment, and then in the debrief, should I ask him or her about his feelings? Should I or should I stay away from it? Should I ask him about their thoughts? What?
That's a tough one, but can I expand on the intense moment for a second?
Yeah.
Because I think there's a point we overlook in training, and I just want to split these two things. We talk about, I don't like the term fight or flight. I think it's too simplistic, right? But we can have an acute stress response in the human body. It entails a lot. Freeze can be one of those responses. And there's some research that says everybody freezes for and I'm like talking, it depends on where you pull your research, right? It could be like milliseconds, right?
Yeah.
And they could think it's an hour, but it's milliseconds, or maybe it's not even noticeable. There's some research that says everybody freezes. Let's look at things a little differently. One, I think we need to figure out, did that person, is this an acute stress response? They froze from fear, or were they decision making?
Mm-hmm. Yeah.
Something novel, brand new for them. What was capturing their attention? It doesn't mean it was fear. And I just want to split those two. And the truth is, we don't know. No. Now, I'm going to tell you, the research goes either way. I'm not going to lie to you. This is the polarizing problem with after action. But let's admittedly say, can we get more benefits in the training environment from maybe a Socratic method and having conversations with officers? It doesn't have to be necessarily, you don't have to frame it about what they were feeling. We can talk about what that looks like, but you can say, hey, in this moment, can you share with me what you were thinking? Mm-hmm. Right? Because the thinking part doesn't attach it. And they may tell you, holy cow, I didn't know what to do for a second. Mm-hmm. That's a freeze. I didn't know what to do. I had to problem solve. Problem solving looks like freezing. Yeah. I don't think we talk about that, but we don't know. And I know we're not comfortable with emotions on the law enforcement side, but like, you can all look at me on this podcast. I have been scared in my life, in my career on duty. I've been fearful. I'm allowed to have that. Yeah. And I don't have a problem admitting it. It's, what did I do with it after? How did I overcome it? So let's just talk about that. I mean, like, that exists, but an officer needs to be during their talking, needs to be able to say, holy crap, I got scared for a second. And then I work through it. Now, if it is absolute, I'm talking, they did actually freeze to a point of it is unsafe. Like they got locked and they, like, nothing happened, right? They couldn't problem solve. They couldn't anything. Different conversation. Yeah. But I think foundationally, we need to figure out, was it freezing? Was it problem solving? Was it, I never saw this in my whole life, right? I've never been exposed to this. That's where we train people, right? Yeah. Ideally, get them exposure to inoculate them. Two things, right? Exposure to inoculation. But I never saw this in my whole life. It took me a second to work through the problem. Yeah. So I think we also need to normalize those things are going to happen. Now, I think if we frame the question, hey, can you share with me, or do you remember what you were thinking at that moment? That's the window that tells you probably which way you need to go. Does that make sense?
It makes sense a lot. Yeah.
Or whatever. Like, I didn't know what to do in this moment. Like, I had to come up with something. That tells you they're problem solving. Yeah. Or, hey, do you know what was going on in this moment? They might be able to tell you, like, they may be able to share with you what captured their attention, right? Because attention is critical in these overwhelming events. What were they paying attention to, or what captured their attention? Those are a couple of things we need to think about. The Socratic method, I think, talking to them, and I think we got to be careful how we phrase it, because sometimes people go through a scenario we make, and I'm talking, it's textbook perfect, right? Yeah. So it's hard to say, would you do anything differently? Because that almost sets the tone for you should have done something differently.
Yeah.
You know what I'm saying? So when sometimes maybe not, maybe like it was seamless.
Yeah.
And then we don't want them to overthink it. So I think the phrasing part of how we ask the questions as instructors and trainers is really critical. You know, and like, I'm not supposed to say, hey, how do you think that went?
Because here in the Netherlands, we had at a police training center, we had a time where we thought that before we could ask them cognitive questions, they had to blow off some steam. So
yes.
that's why we ask, well,
cute.
how are you feeling and so on. But later on, I became a little bit confused because if it went wrong and they were very emotional, I'm not sure what I'm doing in those with those feelings. But is there a general recommendation for the debriefing of scenarios? What to ask?
There's not a really great recommendation, but I want to touch on what you said in the change in protocol. Yeah. We used to, because you're hitting on something, cognitive and emotion, right? I really, if I had to assign a percentage, we're 80% emotion and 20% cognitive in the brain, if I just had to pick some, right? So we're asking a lot of people if they're feeling whatever it is, for that 80% to override, you know, or for the 20% to override the 80. But what you hit on, I think, is more important. We realize we probably shouldn't be asking the cognitive questions when they're amped up. What I'm telling you is, what I would say is, it's not about asking the questions right then. They need to blow off steam, normalizing how they blow off steam. It's not about asking them how they're feeling. That's where you integrate the breathing and the grounding and the stuff you're feeling, because like I said, we get those responses not to the top level, but pretty consistent with some of the stuff we see in real life. So I would encourage, and the problem is, Eric, there's research all over the place on both sides. I'm just being honest. Like, there's no magic answer. But what I can tell you, if they're feeling all sorts of ways, that is not the time to ask questions, right? You hit that nail on the head. It is the time to go, let's breathe. This is where, when you just got into a shooting or something just happened, this is where self-regulation occurs. Yeah. This is where you do it, and then have them do it. If you have to have them do it with you so they get the hang of it, or this is where you're teaching it, that's what I would say. Now, when you want to, whatever cognitive questions, let's say we are going to go down a path of cognitive questioning, it needs not to happen till the physiological changes occur. Yeah. What we tend to do, even in real life events, we're up in an officer's face when they haven't dumped all this, and you're going to get all sorts of things coming out of their mouth, right? They're not even ready. They're not even ready. You know, sometimes they can't remember their birthday in that moment, and that makes sense, right? Because they're still super amped. I think it's a better discussion on shifting the culture of stop asking questions when somebody's amped. Yeah. It's no different from a chemical. I just want you to understand, like a biochemical, than a kid throwing a tantrum. Can you reason with a child throwing a tantrum? Is that the time to have a conversation? It is not. Neither is it when somebody's amped up. And that's beyond officers. It's your witnesses, your victims, you know, like all that kind of stuff. You can't get a good statement from a witness to a pedestrian fatality when they are still like this. Yeah. In fact, they may be talking gibberish to you. Oh my God, right? You know, because they haven't dialed themselves down. What do they need? They need to breathe. Yeah. So officers need to integrate. That's where I'd integrate breathing. Then is the discussion, what's the best question to ask? And I'm going to tell you, that's a tough one, only because the research is pretty split. Now, in a debriefing, like if we want to go like traditional critical incident debriefing, there's research on both sides. Now, there's a really crappy white paper that and that's written in the 90s about that critical incident debriefs hold no value. Yeah. That research has been debunked. It's old, it's horrid. The fact that that's still floating around boggles my mind. Yeah. But here's the bigger conversation I think we need to think about. What should be, let's set the tone for what a critical incident debrief should be. And it should be, at minimum, educational for people. Agencies have a distorted perspective, thinking if I do a critical incident debrief, whatever that is to them, they think it means no trauma is going to set in. Now, I've magically done this one-time event, and now nobody's going to get post-traumatic stress. Wrong. You don't dictate that from people sitting in a circle. That I mean, flat out. Yeah. It needs to be psychoeducational. Yeah. And people, if they want to talk, I need you to understand what is most important is it needs to be audience specific. it would be not appropriate to mix civilian witnesses with officers in the same critical incident. We don't, we want to talk about appropriate populations and mitigating trauma as much as we could. An appropriately run, structured critical incident debrief is not going to add to anybody's trauma. It's not going to make things worse, but it needs to be population specific. It needs to be run by people trained. This is my frustration, and I straddle both sides between police officer and clinician. The fact that we keep removing clinicians out of our services provided is wrong.
Yeah.
It's wrong. Peer support is not by itself effective enough to fix all problems. We need to have trusting clinical relationships with people and peer relationships. But I think the bigger problem I see with critical incident debriefs is we're only as good as our training to include in peer support, and we're only as good as our continued training, not the training we had in peer support 15 years ago. The now. What am I doing to continually train on best practices? I think peer support at minimum, if they don't add grief counseling, that is not appropriate. People experience grief all sorts of ways. People need to be, and your peers are not trained. They're not clinicians, right? They're not the ones that can determine a whole lot of stuff that clinicians could, but there needs to be a trusting relationship where clinicians understand first responders and all the expressions that we go through, and they don't, pathologize certain things. And I tell people this because officers are afraid, like if I say something wrong, they're going to take my gun and inpatient me, right? I need people to understand this. Every civilian that comes to us is not put inpatient, okay? I mean, I really want first responders to understand that because they're very reticent to express how they feel. And some of them, when they have expressed how they feel, they've been absolutely screwed. That's part of the problem. They've been screwed over by clinicians who weren't trained appropriately, or even by some of their brethren who didn't understand normalized expressions of trauma, okay? But the deal is, even with civilians, inpatient is more the exception than the rule. The goal is to help people and support them and be foundational within their community. The norm shouldn't be the inpatient. When we put people inpatient, civilians included, if you don't think we're spending time having to do therapy on the inpatient experience, you're wrong. That's a reality. So I know that was kind of an all over the place answer to your question. It's just, there's so many facets of that. We could do a 2-hour, easily 2-hour conversation on just the intricacies of CID, right? And what that should look like. But I think the biggest thing for everybody to know is to know what it is not. And it is not going to necessarily prevent anybody in that room from getting post-traumatic stress. It doesn't mean it's going to add to post-traumatic stress either. There is value to be found in psychoeducation. So I know that I just saw this, felt this, experienced this, and I know it's normal. And I know when it's time to potentially seek help. Because you can feel all sorts of crap, feel all sorts of ways for a couple weeks. If that continues, your little reset button's probably getting a little stuck. And the goal is we don't want that reset button stuck. We want to unstick it as quickly as possible. But for 2 weeks, I mean, give or take, like, you're going to feel all sorts of things. And you could be totally shut down. You could be totally amped up. You can be all the way in between. An abnormal reaction to an abnormal situation is normal, right? So I think that could be a foundation where people start, understand what it should be versus what it isn't, and then kind of do good, solid-based research to determine how it's best to run through them. I would not get rid of them by any means. They need to be structured appropriately. People need to be trained to understand. And if people aren't trained in first responder expression, we're different. Like military first responders, we express differently. Gallows humor. Goofy statements, right? And if people don't understand that, they'll pathologize it, and we'll all be impatient. Right? So I just want to kind of set that as part of it, but it should be at minimum definitely an education for people about expectations of the realities of your how you're going to feel, any behaviors after a critical incident.
Well, I think you're really passionate about this, eh?
I am.
I love it. Yeah. Well, thank you so much. Yeah, I can talk for, I have to sit on my hands because I have so many things to talk about.
I know you got to make that pizza. But
I've
if you have
got-
some follow-up questions,
Yeah,
get hold of me. I'll send you a link for Robbie's book where
Yeah.
people can get it. And I just want everybody to know she doesn't make a profit on that book. She sells it for what it costs her to print it.
yeah,
I don't get any kickbacks. It's just that's where I use a lot of the strategies in that book for a lot of stuff. Like I'm not the magical expert here. I get to stand on the shoulders of giants who have done this work. That is the reality.
yeah.
I'm just lucky with the relationships that I have to be able to impart this. And I'm lucky because I bridge the gap between clinician and police officer.
That's great. Yes.
So people we can tend to have some really robust conversations about the realities on both sides because I've been there.
Yeah.
And so I'm very appreciative of both my roles. So I can send you a link. I'll send you some links to some coping skills and we'll go from there.
Can you imagine that I also wanted to talk with you about de-escalation?
We can do a whole nother one on de-escalation. Honestly, that's my second favorite topic. It's wellness and de-escalation.
Yeah,
so I love de-escalation. So anytime you want to do that, you just let me know.
Yeah. Then I have to make another pizza. Yeah. Well, thank you so much, Nicole, for doing this and for your work and the great institute you're working. I've talked with Dr. Lewinsky. I love his work and all the people involved. And thank you for your enthusiasm also. It inspires me a lot.
Sorry. My dog was barking at the end of your podcast, so wanting to be famous, wanting to be famous. Thank you, and thank you again for the opportunity.
Yes. I will go to make a pizza. Yeah, a Florisi pizza. And we will. I hope I will talk to you sometime again.
Oh, I hope so. Thank you.
Have a great day.
You too.
Bye bye.